Hi, I'm Christina Mozaffari for HIV.gov here in Montreal at the International AIDS Conference, where today we're talking about some takeaways from the conference. I'm honored to be joined by Ambassador John Nkengasong. He's the U.S. Global AIDS Coordinator and Special Representative for Health Diplomacy, and Harold Phillips. He's the Director of the White House Office of National AIDS Policy. Gentlemen, welcome.
Thank you.
You know, Ambassador, I'd like to start with you. It's been a busy and dynamic conference, and I'd just love to know from you if there was one particular standout moment or learning that you'll take away from this and take home.
I think there were two key moments for me at this conference. First, when we started the conference, we saw very disturbing trends that we are not in the right trajectory. This was based on the UNAIDS report that showed that we registered about 1.5 million new cases. However, we also saw a message of hope from Botswana that Botswana had exceeded the 95 targets. Remarkable. If we know where Botswana was just a few years ago and where they've come from, I think that speaks to what is possible if there is strong political leadership, commitments, and partnership. We also saw incredible results from PEPFAR, that 5.5 million children were born free of HIV/AIDS, that PEPFAR put in 20 million people on treatment last year, uptake in PrEP treatment. Those are all remarkable results, that at least 12 countries have exceeded the 90 targets. That is 12 countries from high-burden countries in sub-Saharan Africa. So I leave the message, I leave this meeting with a little bit of hope, despite the overall trends that are disturbing.
Harold, same question to you. What are you taking home?
Well, one of the take-home messages for me is that the United States and the rest of the world needs to continue to have a focus on HIV. A lot of our progress was delayed due to COVID-19, but everyone has called for us to continue to prioritize access to HIV prevention and treatment services, address equity, think about social determinants of health and their impact on putting individuals at risk or living with HIV. So food insecurity and housing instability also contribute to all of these factors, and that we need to continue to invest appropriately in HIV so that we can take our best of the implementation science, some of which we've heard here, and really think about how do we bring that to scale and how do we serve populations equitably without leaving them behind.
You know, Ambassador Harold just mentioned implementation science, and I know that that's a focus for PEPFAR as well. How do we make sure there's that uptake around the world? Was there anything that came out of the conference that gives you new ideas or innovations or points you in a new direction when it comes to implementation?
Definitely. The whole concept of long-acting PrEPs, that is drugs that you can take for prevention of HIV/AIDS, that will last for a couple of months, is an area of renewed interest for PEPFAR, that we need to build the right partnership coalitions around us so that the time between the availability and access to those drugs and uptake in the communities is really shortened. And we will be working with other partners to ensure that there's enough knowledge on understanding those gaps that will allow us to quickly move into that product into prevention strategies.
And Harold, when it comes to implementation in the U.S., I know the strategy really calls for a more community-focused implementation. Have you heard some new strategies or taken any takeaways from that?
Sure. I think one of the things that was re-emphasized in several sessions in the conference include the need to be person-centered in our approach. And in order to understand person-centered approaches to prevention, care, and treatment and the options that individuals need, we need to be partners with the community and really listen to the community and involve them in all aspects, setting the research agenda for our countries to both implementing services, whether it be prevention, care, and treatment, and also helping us in the design for the service delivery itself. So when implementing sort of the best of the science, still being able to check in with the community, get the pulse, and also make sure that as we're doing it culturally appropriately, and that we're reaching populations that, we have labeled as hard to reach, but they're there, and we need to involve and engage them as part of our response.
Ambassador, I'm going to ask you to pull out your crystal ball and look a little into the future. These international AIDS conferences are every 2 years. In 2 years, what do you think that we'll be talking about?
In 2 years, I hope we can be talking about sustained funding for the pandemic. We saw the data from UNAIDS is not encouraging. It says that if the trend continues the way they projected, we may not reach our target by 2030. But if we have increased funding, as Harold said, and that would allow us to sustain the fight against HIV. So in 2 years, I really like to see the global community that is re-energized, refocused, and making available more the necessary resources to fighting the pandemic.
Ambassador John Nkengasong, Harold Phillips, thank you so much for your time today.
Thank you.
Thank you.